Everybody knows that informality is not illegality. It doesn't mean if we are living in an informal settlement, we should not be included in any of the arrangements, planning for the city.
The community, what we are suffering about, there is no good drinking water.
If students want to study, they don't have light to study.
It is very impossible for someone who is using a wheelchair to live in this part of the city.
Before we started Arise, we had to bring together community members, and we call them co-researchers. Some have disability, some have no education, no formal education, some have very little education, some are university graduates, and when we say co-researchers, they are really part of us. So we design the research with them, we design the data collection tools with them. Sometimes they lead in the data collection.
Because at the end of the day, they are the ones that will decide what they want to do with that data, how they want to, advocate for their community using the data we've generated in their community.
And we have been involved in several projects or several activities on the Arise project on health and well-being, sanitation, livelihood, and other stuff.
We try to co-analyze those data and make the data be owned by the community. So they have used our data to actually show that there is a climate change issue, or we don't have health opportunities, or we don't have access to water. So they use our data for decision making, but with evidence.
We are working in collaboration with the senior researchers. So the key factors is teamwork. They are including us to be part of all the work that they are doing, and also they are also giving us the knowledge.
Beyond the research, they'll be able to, advocate for themselves without, external support. So that's one of the novelty around the Arise project, which I think is really unique from the other projects we've been doing in informal communities. The Responsive Fund came as a quick response to mitigate the spread of COVID-19 within informal settlement. There was vaccine hesitancy within these communities because they said the vaccine came in as a way to reduce the African population.
And also we also give a support to the community in terms of giving them little food items that they can use particularly when there are lockdowns, for them to survive during those difficult times.
The lesson learned here is to include informal residents within planning, and also ensure that whatever design that is being made for the formal settlement within the ministries, within NGOs, international communities, it actually needs to capture the people living in informal settlement.
Through this Arise project, we've been able to capacitate community members about the realities of their community and how they can hold their leaders accountable. That is possible because we involved community members in the research process.
Even though I'm living in an informal settlement, it's my right to advocate or to go for any position in politics if I want to. So that's why we are raising our voice for them to say, if our vote is count, then our voice should be count. The reason because informality is not illegality.